I'm married to Joseph Knott, and I'm from Phoenix, Arizona, not originally a transplant to Phoenix, Arizona. And we've lived there for over 10 years now.
Mm.
And we've decided, what brings us to Los Cabos and also to Wheel Assist is I got an umbilical hernia about a year and a half ago. And fortunately, it was the kind initially where just the fatty tissue comes through. So it was really no emergency. I lived with it for a while. But then that changed and it turned into I didn't know yet, but it became more painful.
Mm-hmm.
Later, we found out it was because then it became the intestine kind, which is dangerous. And in the United States, when you have hernia repair, they do mesh. And I did not want mesh. So to have insurance cover it, you had to have mesh. If you don't have mesh, then it becomes more a plastic surgery and it is not covered by insurance.
Mm-hmm.
So I did not want mesh, which meant we would have to pay out of pocket. Fortunately, my husband's very supportive of the decision that I made. And then I realized I had choices because we were going to be paying anyway ourselves. So I got 5 different consultations, 3 in the US near home and 2 in Mexico. And when I looked at all of the different quotes and what everything would cover, I realized that no matter what I chose, it was not a significantly different amount of money, but what I was receiving was significantly different. And I realized that I was going to receive so much more in terms of my care if I did medical tourism, choosing Mexico, or there are other countries that do medical tourism, but I didn't want to go too far away from home. I felt more comfortable being closer to home. And then amongst the 2 different organizations that I examined in Mexico, Will Assist by far was the most outstanding organization. And we had many conversations, and I also spoke to the surgeon as well. And that was very important, getting to speak with the surgeon, to have that confidence and that comfort in knowing that you and your surgeon also have to see things eye to eye and be on the same page and kind of like each other, you know, in a way. You really do need that. And that was very helpful because not every organization allows you to interview with the surgeon at that earlier stage. They kind of keep that for the very end of the whole stage of getting things set up. So that was very meaningful. And then I chose Wheel Assist, and really, I have had the most wonderful experience with Wheel Assist. Everybody here, first of all, your staff is amazing. You have selected top-notch people, from the surgeons to the nurses staff, to the administrative staff, to the drivers, to the ambulance drivers. Everyone's certified. Some are double board certified. Some are board certified in multiple countries. And everyone is an expert and a professional. In addition to that, they're also extremely caring. And whatever it is that you need, it will be taken care of. From when you get off the plane to when you get back on the plane, you are completely protected. You are driven where you need to go. You don't have to worry about finding anything or getting lost or, you know, maybe ending up someplace where you didn't plan to end up. So you're totally protected and totally enveloped by the entire staff at Will Assist. So it's been an incredible journey, and we could not be happier. One thing I have to say is everything is so spick and span, spotless. If you look around, everything is completely sterile and completely clean. And that's very impressive because in any country, you can go to many facilities, and while the center part might be clean, if you look in the corners, you're going to see things. Not so with Wheel Assist. And that goes for your ambulance and for your clinic and for the surgical center. Everywhere that I went, everything was spotless and very professional. And I was completely taken care of everywhere that I went. So in addition to the repair of the hernia, in order to repair a hernia not using mesh, you have to repair what they call the diastasis recti, and you have to sew that back together again, suture it. And that actually happens to be part of tummy tuck procedure. So I figure while the hood's up, let's go ahead. No time like when you're in there. Let's do it. So we went ahead and did the tummy tuck as well as Lipo 360, because if you just do tummy tuck and you don't address the surrounding areas, and then it doesn't look right after that. And then, since you're harvesting with the Lipo 360, I went ahead, at 63, I could use a little reshaping, and in what is behind me. And so they used what was harvested with the Lipo 360 to address the shadows, is basically how Dr. Topete put it, and correct the shape at this point. It was a great opportunity to do that. We had to go in anyway. And because of what I wanted, we had to do the other part. So it made perfect sense to do the whole tummy tuck and do the lipo and use that to do a reshaping do the BBL. So it made total sense. And the surgeon, Dr. Topete, agreed with that. It's a good sign when someone tells you no, because plastic surgery is a wonderful thing, but you have to be careful with it because there's an addiction factor to it. And so when you start looking at the whole list of things that can be done, you're like, oh, I want one of those, I want one of those, I want one of those. And so Dr. Topete actually said to me, he said, okay, yes, 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 no, this is enough. This is what we're going to do. We're not good another time. And so I really loved that. I loved that he put the brakes on it. He wants the best result possible, and he is an expert surgeon in his field, and he was able to tell me from his expertise what was the smart thing to do, and to just tell me no. Especially now that I've had this experience, if I was ever going to have anything else addressed, there is no question. I would not even need to do any additional research, because we've been here, we've worked with you. There is no question. The quality is top notch. And we definitely would be return customers if the situation presents itself in the future. And also my friends. I have friends who might be interested in doing this or doing that, and I can tell them firsthand exactly, if they work with Will Assist, what they're going to receive. And something I didn't get to cover in a previous answer that was very important was aftercare. In the United States, how the system works is I would have been sent home the same day. I cannot imagine that. Even before going through it, I could not imagine going home the same day. I feel like that's barbaric. Now, having gone through it, I really cannot imagine what we would have done. Cannot imagine what we would have done. And so that's the analysis that you do. You see, okay, quote, 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 what does it cover? And this one was going to take care of me afterwards. And that was really very important, because my husband is a wonderful person, but he is not a nurse. And so I really didn't picture that working out very well. And I really also didn't want to put that on him too. I didn't want to burden him with that responsibility. So that was very important. And your aftercare cannot be beat. Hasmin came twice a day, at least twice a day. And occasionally Dr. Diego came and changed bandages, checked bandages, made sure everything was okay, helped with whatever you needed help with, and then bandage you back up, and then check on you later today. If I needed anything, I could use WhatsApp and reach any of you to let you know that there was a problem. It was not. I didn't have that situation, but I could have contacted you if I needed to at any time. So that was very meaningful, the aftercare. We didn't plan this. We didn't plan for something to happen to Joe. That was not in the plan. We planned everything else. And lo and behold, we land and Joe becomes extremely ill. And what do? And fortunately, we were already involved with Wheel Assist, and Wheel Assist just took the ball and ran with it. And was just as they would do for me, they did for Joe, and brought him to the doctor, and they checked various things. And it, as anywhere, it's going to be a process to get to what is the problem, and took him through the whole process, and we got him into surgery. So your plus one was also your patient. I came for plastic surgery, but Joe needed all the other wonderful things that your company has to offer. And thank goodness that you do have all those different parts of your company, because you were able to take care of what we needed.